starting the skeletal system. This is where a lot of people really start to get interested in anatomy. A lot of students do not love histology. I like histology. Skeletal system is, of course, more tactile. You can really see and understand what you're talking about. Before I get into it, I want to do a little intro and a little guidance on how to study bones well. But first off, I want to point you to the top of your notes in which I tell you what you're responsible for. Okay. So in your textbook, the skeletal system covers 4 chapters. Chapter 6, which is really sort of the setup, organization, basic structure of the skeletal system, how to know what the names and the parts of the names, the names of the bones and the parts of the bones mean. Chapter 7 and 8 are axial and appendicular skeleton. So if we look at my friend here, you guys remember axial, the term that we learned was associated with the long axis of the body. Axial skeleton would include the cranial and facial bones, the vertebral column, the ribs, the sternum, vertebral column all the way down to the sacrum and coccyx. Okay. And then the appendicular skeleton would be, it's in chapter 8. All of the skeletal elements that are associated with the appendages, including the things that hold on to the appendages. So you'll have 2 weeks in lab over skeletal system, axial skeleton and then appendicular skeleton. Usually axial skeleton is like the first really hard week when you feel kind of overwhelmed. So one of the things that I'm going to do today is give you some guidance as to how to make that a little bit more comfortable. And then chapter 9 is articulations, which is just the fancy word for joints. Chapter 9, I do part of it with bones and part of it with muscles. So just follow your notes and you'll know which part goes with which. But here's something really important. You are responsible for anything covered in lecture or lab that is in these chapters. But if it's not in lecture or lab, then you're not responsible for it. So use your lab book as a guide and your lecture notes as a guide to what you should study. And then as far as what is going to be important, there is a list of bones and features of bones. And you are responsible for everything in lecture that you learn in lab. And I tend to use those lab bones and bone features as examples in lecture. And then I'll put some of them on your exam, your bone exam as well. And I wrote the lab list, so I know what's on there. Okay, so let's just get started with a little bit of introduction to the skeletal system as a whole. So what does it do? It is primarily, of course, supporting connective tissue. It's bone and cartilage primarily. And it supports the body. But in some places, it's also protective. So if you look at the skeleton as a whole, blow this up for you real quick. If you look at the skeleton as a whole, there are some places in which the skeleton is really more about leverage for body movement. For instance, these bones here, leverage for body movement. And then there are some places in which the skeleton is also really protective, like the rib cage and of course the cranium. It's really protective in those locations. So protection of some of the softer body parts. And then the skeleton doesn't move your body around, but it does provide leverage for body movement. So you guys, most of you know where the deltoid muscle is. The deltoid muscle goes from the clavicle and scapula right here and inserts onto the deltoid tuberosity of the humerus. And it uses this portion up here to pull. So the skeleton isn't doing the movement, but you're using the skeleton as leverage to move. Okay? All right. So, it also provides a big storage reservoir for some important body minerals that you talk about calcium a lot in physiology. Calcium is so darn important that you definitely need to make sure that you have a storage bank for it. It also stores phosphorus. The skeleton stores phosphorus, and also fat in the yellow marrow. And then, of course, the skeleton, specifically the red bone marrow of the skeleton. Your red bone marrow is a connective tissue that makes another connective tissue, which is blood. The red bone marrow makes blood. Okay, so that's some of the basic functions of the skeleton. Now I want to just take a few minutes and give you some starting points for studying bones. So in a typical semester, of course, you would be doing this in the lab. This, however, is not a typical semester, and 2020 has not been a typical year. So some of my pointers will be easier to access if you have the ability to go into the library or go into Open Lab or go into the STEM Center and actually take out the bones and study. Whether that's going to be possible or not is as much your guess as mine, but we are certainly hoping that it will be possible. So first thing is, when you're studying bones, don't forget that vocabulary is not always a hindrance. Sometimes it's really helpful. So let me show you a few things. Okay, so here is a small list, of some of the terminology that's associated with the meanings of bone markings. So you run into a whole bunch of different bone markings, and how are you supposed to know what's a fissure and what's a trochanter and what's a tubercle and what's a sulcus? Well, it really helps if you actually learn the meanings of those things. So this figure 617 in your textbook has some of the major bone markings, what we call them, and what they mean. And the reason that is helpful is because if you know that, for instance, a condyle is a rounded articulating surface, then it's not too hard for you to figure out that, let me make it big enough that you can see me, but not too big, that this little articulating surface might be a condyle. And then you go look for condyles elsewhere and you figure out, oh, okay, every time I see a condyle, it looks kind of like a knuckle. Okay, so understanding the meanings of bone markings is super duper helpful. In addition, I would recommend every time you find a condyle or a stylus or a ramus, see what it has in common with the other stylus or the other ramus. So for instance, on the mandible here, don't break the skull, Melanie. On the mandible here, this portion that's sticking up right here is a ramus. And if you look at the definition of the ramus, it's an angular extension of a bone relative to the rest of the structure, kind of like a branch. It's not the only place that you're going to see a ramus. You are also going to see foramen and fissures. And foramen, you can see a rounded passageway through the bone, and you've got some foramens right here. You're going to have a whole bunch of foramen. Foramina is actually plural for foramen. Okay, so my next recommendation is that since you are going to have to learn both bones and features of bones, you start getting into a really good habit. This skull is color-coded. We have one of these at least one of these in each lab. So you can tell the boundaries of each bone. Let me blow this up a little bit more for you. Okay, so this big bone right here that's in yellow, this is the temporal bone. And to be specific, it's the left temporal bone. This projection right here, okay, is sticking off of the temporal bone. So you can tell that this belongs to the temporal bone. This projection right here is called, so just stick with me, this is called the zygomatic process because it processes or sticks out toward the zygomatic bone. But that's not really a good way to remember it. What you really should do to get into a really good habit is to say, okay, don't call this the zygomatic process. Call this the zygomatic process of the temporal bone so that you know it's part of the temporal bone. This little guy right down here is the styloid process of the what? Of the temporal bone. Okay, and if you even want to be better, you say this is the zygomatic process of the left temporal bone. This is the styloid process of the left temporal bone. This is the auditory, external auditory meatus of the left temporal bone. They all sound really impossible right now, but it gets a little easier once you figure out what things belong to, which is why this color-coded skull is sometimes really good to start with. Okay, so get into good habits is what I would recommend. Good habits of not letting yourself say zygomatic process unless your brain says of the. In this way, there are no trick questions because I can label any of these structures here and you're always going to know that it belongs to the bone called the maxilla. Any of these structures here and you're always going to know that it belongs to the zygomatic bone. Okay, so and then a couple of more tips for you guys. So when you get to doing the bones, especially of the appendicular skeleton, I'll grab some for you. Each time you look at the bone, it's impossible to hold on to all this stuff at the same time. Each time you look at the bone, try to figure out like what you're actually seeing. So when you look at a bone that you've seen before, a lot of you guys might actually know what this one is. You might even be able to do left and right. What you need to be able to do is to figure out how to know whether you're looking at the anterior portion of the bone or the posterior. So you find a landmark that is really dependable to you. It doesn't really matter what the landmark is. But if it's an anterior one and you can't see it, then you're looking at the back of the bone. For me, this bone and a lot of the bones arch anteriorly. So if I put it down and it looks like a rainbow, then the anterior portion is up. It looks like a smile and the posterior portion is up. So it doesn't matter what you use. And then you also need to find a lateral or medial landmark. Okay, so this articulates with the hip bones, the pelvic girdle, the ossa cocci. So this is a medial landmark. This helps you to position where the bone would be in a person. So if I'm looking at it right now, I try to figure out where the head would be and the feet would be. And I'm like, oh, okay, so the body is right here. This is anterior. Now, and I know that this is superior and this is inferior. Okay. So although since we're talking about a limb, it's better to say proximal and distal. So this is proximal and this is distal. And that lets me know that, okay, this person is facing the camera. Head is up that direction, tail or toes are down that direction. And this helps you kind of position the bone to picture where it would go in the body. And that's really important because eventually you're going to have to know lefts and rights for bones and not just the name of the bone or the features of the bone. So one of the ways to get better at this is to go get access to a 3D bone, whether it's in the STEM center or the library. If you can't, then you're just going to have to practice with pictures. If you can get access to a 3D bone, practice at first touching it, flipping it around so that you can see, and then later on just have somebody take it out for you and you figure out where it goes in the body, where the head is and the feet are, without touching it. And then don't forget that you actually have a cheat sheet. Like, I can figure out where this bone goes into my body and I can sort of orient it to my body, and I can say, oh, okay, I'm looking for the head of the femur, and the head of the femur would be right about here. I'm looking for the medial malleolus, or I'm looking for the greater trochanter. And using your visceral senses to touch or connect to your own body can help you with recall. I know it will make you look stupid, but nobody's going to see you anyway. It doesn't matter. And then the last little thing is that if you want to be good at writing or typing something like the head of the femur or the zygomatic process of the temporal bone, Don't just say it every time. You have to type it or write it, because spelling will count eventually, especially in lab. So each time you get a little better at practicing the bones, practice writing out the name of the bone instead of just saying it aloud. And then as you get a little better, you need to practice spelling. You need to practice assessing whether you're spelling it properly. Okay, so those are your tips for practicing for lab, and then we'll get into the actual structure of bones in the next video.